Hi, my name is Emilio Ortega and we'll talk about of Ledipasvir and Sofosbuvir in 8 or 12 weeks for chronic HCV without cirrhosis. In the definition, we have that cirrhosis is a liver disease characterized by the formation of scar tissue in the liver. As consequence, liver function begins to decline as scar tissue affects blood flow and the liver's ability to process. In example, withdraws hormones and natural toxins at the same time that affect the production of proteins and other substances. Application in medicine. The Ledipasvir and Sofosbuvir we can use in treatment of chronic HCV infection hepatitis 1 and 4. We know that it's safe and effective. So we can use the same treatment for HIV, but isn't cured.
Hepatitis C is an RNA virus that can lead to chronic liver disease. It's the number one reason why we still transplant people in this country as well. At Ohio State, we see a lot of hepatitis C patients. We're a large referral center for hepatitis C. The CDC thinks we have potentially 4 to 5 million patients with hepatitis C. Unfortunately, half of those patients don't even know that they have hepatitis C. We didn't even know about hepatitis C until 1989. When someone is exposed to hepatitis C, unfortunately, they have potentially an 80% chance of developing a chronic infection. And when they develop a chronic infection, they can be completely asymptomatic as well. And a lot of patients that we get the referral from that didn't even know they had it, they went into their doctor's office and had a routine physical exam and noticed some elevation in their liver enzymes, and then further workup led to the diagnosis of hepatitis C. And then we get that referral of how to best manage that patient from there out. So the most common cause of contracting hepatitis C in this country is intravenous drug use, but it's really any blood exposure. So tattoos, body piercings are other risk factors, and it can occur in sexual contact, but in a monogamous relationship, the chance of a partner contracting hepatitis C from their spouse or significant other in general is less than 5%. So hepatitis C has been getting a lot of press recently because we have a lot of new medications coming out for hepatitis C. There is a treatment and a cure for hepatitis C, which a lot of patients don't realize. Some patients know that there is treatment for it, but they don't realize that this treatment can actually cure hepatitis C. Hepatitis C treatment really has been revolutionized over the last few years. The treatment prior to 2011 included a kind of a shot once a week and then pills every day. Uh, Potentially lots of side effects with this regimen, not a high chance of curing the disease. And then in 2011, we were able to start using some direct acting oral agents that became available. And the future of hepatitis C are these direct acting oral agents, which are just pill forms that directly attack the virus. And just recently, we've had a kind of an influx of these pill forms that have been FDA approved, and we will continue over the next few years continue to have more oral combinations available for these patients with hepatitis C. And what that allows us to do is one, gives us a much higher chance of curing the virus, and then two, overall much better tolerated with fewer side effects, and then three, also shortens the treatment duration from potentially in the past even up to a year to even in some cases as little as 8 weeks of therapy. The problem with hepatitis C long term, just like with any hepatitis, is if you have active inflammation in the liver, the problem with that inflammation is eventually it can turn into scar tissue, and that's what cirrhosis is excessive scarring in your liver. And then so hepatitis over time can lead to excessive scarring in your liver, and even cirrhosis. So I quote patients if they are acutely exposed to hepatitis C. In general, they have about an 80% chance of developing a chronic infection, and out of that 80% that has developed a chronic infection, around 1 in 4 will potentially develop cirrhosis over their lifetime. And then once they develop cirrhosis, they have about a 3 to 4% chance per year of getting worse or decompensating, where the only thing that can potentially help them in the future is a liver transplant.
Pros and cons. In cons, we have the some common cons that fatigue, anemia, headache, and nausea were the most common adverse events. In pros, we know that fibrosis improvement and increase the life uses and placing network. Sofosbuvir are specific antiviral for treatment to cure the hepatitis. It's not used alone, not even in combination with ribavirin, but in combination with another antivirals, such as sofosbuvir with dolutegravir, sofosbuvir with ledipasvir, or sofosbuvir with daclofenozin, among others at the list we have on there. In Ecuador, we don't have the, the ledipasvir, so we will have a, a complement treatment. This is the problem in the country.
Chronic hepatitis C virus infection, or HCV, causes progressive liver fibrosis, which can lead to cirrhosis and hepatocellular carcinoma. An oral regimen that would treat patients infected with many of the possible viral genotypes was tested in this phase 3 double-blind placebo-controlled trial. Treatment-naive and previously treated patients with HCV were enrolled at multiple sites in the United States, Canada, Europe, and Hong Kong. All of the patients were chronically infected with HCV 1, 2, 4, 5, or 6. Patients with and patients without compensated cirrhosis were included. Study participants received one tablet daily containing either Sofosbuvir and Ledipasvir or placebo for 12 weeks. The primary endpoint was a sustained virologic response 12 weeks after the end of therapy. Of the 624 patients who received Sofosbuvir Ledipasvir, 99% had a sustained virologic response. None of the patients given placebo had a sustained virologic response. 15 patients who received Sofosbuvir Ledipasvir had serious adverse events. The most common adverse events were headache, fatigue, nasopharyngitis, and nausea. The authors conclude that once daily Sofosbuvir Ledipasvir for 12 weeks provided high rates of sustained virologic response in treatment-naive and previously treated patients who were chronically infected with HCV 1, 2, 4, 5, or 6, including those with compensated cirrhosis. Full trial results are available at nejm.org.
In the conclusions, Ledipasvir and sofosbuvir for 8 weeks was associated with a high rate of sustained virologic response among previously untreated patients with HCV and a type 1 infection without cirrhosis. No additional benefit was associated with the inclusion of ribavirin in the regimen of with extension of duration of treatment to 12 weeks. Thank you.